This conference will now be recorded.
Hello, everyone. This is Jonathan Hodel, CEO of TheraHealth and Wellness. I wanted to take some time. It is Saturday, March 21st, 6:05 p.m. I've been getting a lot of calls from concerned patients, therapists, office staff, clinic employees about the coronavirus, just everything in general that's going on right now. These are difficult times, unprecedented times. So we've been working nonstop to not only weather the storm as far as the spread of this disease by putting sanitary and patient safety, hygiene, all of those techniques that we should be using on a daily basis anyways, but reinforcing those, including to what we do for those protocols and procedures. But also I wanted to reach out. I put something together here with the help of with Ashley and Aubrey and Jen and Liz, and I've been attending a lot of different virtual meetings with the various healthcare organizations, and I wanted to put something together that focuses on you, us as a company, our staff, our individual therapists, our patients. We don't get much help from the federal and even from the state news. I want to just go over some things and some resources that's going to help you, your patients, our patients, yourself, your family, and your loved ones, from healthcare, from economic, and just from a personal level. So I have over here, I'm sharing my screen. I've got a whole bunch of stuff on here. So I am going to start off. I'm going to try to break this down to three areas. First part is going to be healthcare. By the way, we've been putting out memos for the corona, but there's just way too much to cover in an email memo. So I am doing this GoToMeeting, recording my voice, sharing my computer screen. Then we're going to be sharing the links with everything that I go over, and then sending it out via text message and email to make sure everyone has access to this. So first, I want to talk about the healthcare impact. As of right now, this second, Florida is not completely shut down, as California, Illinois, and New York are. I think it's only inevitable before that happens, when you're able to only leave your home for essential services or essential needs, such as pharmacy or grocery, and jobs that are required essential. So what I first wanted to do is on a conference call last night with Clinician, our EMR system, and they shared with me this from the Homeland Security memorandum. And it deems all of the essential infrastructure workers. I got this directly from PPS. I've got a whole number of links here. I got this from www.ppsapta.org. And so that's where I have here. You know what? I'm just going to go into it so you can see how I got to this part. ppsapta.org. Okay. And this is the private practice section of American Physical Therapy Association. And if you go down here, PPS News, and payment policy, your help is needed. You click on that. And then right down here, Homeland Security Memorandum on identifying essential critical infrastructure workers. Learn more. And then it specifically states physical therapists are essential in flattening the curve of the COVID-19 pandemic. They play a key role in keeping people. They can help out doctors' offices and ERs. They will not only free up the medical teams to treat those impacted by COVID-19, but also limit the exposure of those seeking the care of the physical therapist. So we, as physical therapists, and that includes therapy, physical occupational speech therapy, we are deemed essential by the Homeland Security. So also in response to that, we have this will be emailed to you. If there is a shelter in place order, we have this legal form here that everyone will carry with them. I also encourage you to carry, obviously, your driver's license, but also carry your therapy license. I'd have that in case of a shutdown. If there is something like that, want you to carry this form on you as well. And this pretty much is a note from myself, kind of like a legal letter, so you could show to any police officers or anything that if you do get pulled over while are you on the road, this show a little note showing that you are deemed essential, part of the essential healthcare provider. And that being said, I've had some people ask me, oh, well, since we're not part of the essential, we're not. If that's your thinking, then you're in the wrong profession. We are essential. It is our job more so than ever to see your high-risk patients, to make sure that they're getting the correct monitoring of vitals, the movement, the exercise. It is essential now more than ever to see our patients. So if that's your thinking that, oh, we're not mandatory, we're not required, then you're in the wrong profession. We are essential. It is mandatory right now for us to see our patients, to make sure that they don't get infection, make sure that they don't have an exacerbation of the COPD, the CHF, make sure they're taking their medications, make sure we're monitoring them, and make sure we're keeping them out of the hospital systems, because we don't want to overburden our hospital systems. So yes, absolutely, we are essential. That being said, we sent out a memo on Monday of this week that requiring everyone to take temperature and O2 stats prior to every therapeutic exercise, to every therapy session. In addition to that, we have the questionnaire, which I'll also pull up here. We need to be talking to every one of these patients, especially if it's a new patient. We need to ask them these before we even have contact with them. Very basic. Have you tested positive or been in contact with anyone who's tested positive for COVID-19? Have they had any of these symptoms the past 2 weeks? Fever, cough, increased shortness of breath, breathing difficulties, increased abnormal nasal congestion, sore throat, unusual fatigue. A lot of our patients have shortness of breath, have cough, have unusual fatigue. We ask them, is it more so prevalent right now than it has been? Also, have they traveled internationally the past 2 weeks? I would say 99, if not 100% of our patients don't travel. But the more important, have they been in contact with anyone who has traveled internationally in the past 2 weeks? So we need to be doing our part before we even get out there, before you even expose yourself to a potentially infected patient. We need to just take basic precautionary steps. So that being said, if anyone's tested, or if they've tested positive, self-quarantine, have to talk to their primary care physicians. And if they do have any of the symptoms, but it's not severe, don't call 911. Urge them to contact the local county department or their primary care physician to seek guidance, seek advice. The only time we want to call 911 when we are at a patient, we arrive to a patient's house, or they are reporting an unusual, life-threatening shortness of breath, a severe case, then that's when we phone 911. But you want to make sure that you report that they are presenting symptoms of COVID-19. Do your part. Simple steps. Hygiene. Personal hygiene and patient hygiene is key. That being said, we've ordered some more face masks, some gloves, some hand sanitizer. We are on short supply, but we do have another shipment coming in, and we are searching day and night for more of these products. We've applied to the state of Florida to get some of these products, not only for our clinic, but for also our home care therapists. So if you're a home care therapist and you need some of these items, contact our office, and there's going to be a sign in, sign out sheet for items that you take. We will be rationing these items because we are in a short supply, but we are looking day and night to get more of these supplies. Face mask, hand sanitizer, and gloves. Obviously, hand washing, social distancing is the most important steps to preventing the spread of this disease. Don't touch your face. One thing that I've been doing now is I keep a roll of paper towels in my car. If I have to go into any Publix, the gas station, or a takeout meal or anything, I take paper towels with me, use that to open the door, make sure I'm not touching any surface. If I have to touch my keypad on the debit card screen, I put my hand in paper towel, touch that. And hand sanitizer after everywhere. Hand sanitizer needs to be at least 60% alcohol based. So we're looking at getting more of that. And also, if anyone has any ideas or has had luck getting these items, face masks, gloves, hand sanitizer, please let our office know. And that being said, essentials. If you're going to go to a physical store, I would highly discourage that. But if you do need to get certain items and you have to go to a store, even if it's food items, I would highly recommend Publix. I would very, very, very highly discourage Costco, Walmart, Winn-Dixie. I've experienced this firsthand at all places. Publix has a system in place. They're disinfecting everything. It's an orderly system. There's not long lines. So that's just a little side note. So I can't stress the importance of continuing our patient care. We do not want our patients to wind up in the hospital. And a lot of these patients are high risk with multiple comorbidities, multiple diagnoses, a lot of things going on, polypharmacy. And we are a lot of times their front line of defense from keeping them healthy, keeping them out of the hospital. We need to free up the hospital space for the influx of infected COVID-19 patients. So that is something that, I just wanted to expand and elaborate on healthcare. We have this right here that just got released from ACA. If you are treating any patients in a long-term care, independent assisted living, rehab facility, they're implementing the use of facial masks. This memorandum will be attached in the email that we send out. If you are going in, they're still allowing healthcare workers, as we are an essential part of the healthcare system to combating this disease. A lot of these places will provide face masks. I encourage you to try to get some of your own if you're able to. And once again, we will be passing out some. We will be giving out some, but we are also on a limited supply. And as far as getting your information, I have some sites up here. Here's just the recent numbers. I just want to put things in perspective. Worldwide cases confirmed over 300,000, 12,000, almost 13,000 deaths. That's about 4% fatality rate worldwide. In the United States, 24,738 confirmed, 291 deaths, about 1% fatality rate. So very, 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 very few people who actually contract this die, and those who do die are the ones that are elderly, sick, multiple comorbidities, and it is our job to keep them safe. We may pass that to COVID to them without even knowing. So sanitary barriers. When you're going to the patient's home, you set your bag down, you put a sanitary barrier down. What that could be is a lot of times I use the pet pee pads, the training pads. We also have some of those if people would like, but those you can buy on your own. Those aren't going out of stock. But the pet training pee pads, those work great for sanitary barriers. Put all your stuff there. hand sanitizer with you at all times as well, 60% alcohol again. And so just so you know, those are the latest up-to-date numbers. To put that in perspective, last year, and I'm not downplaying the seriousness of this whatsoever, but I just want to kind of just put it in perspective. Last year's flu season, there was 34,200 deaths in the United States. The year before that, 61,000 deaths. That's straight from the Center of Disease Control. We're nowhere near that, but this is something that can spread from person to person. So that's why this is so severe and needs to be addressed right away. And we need to do everything that we can to ensure our patient safety, but also ensure the continuation of what we do. And I also have the Florida Health site for all the information about COVID-19. Call before you go in, wash your hands, avoid touching your face, social distancing, what we've heard from everyone, and has positive cases and so forth. So get your information from here, Center of Disease Control and Prevention. These are going to be accurate sources. Don't go on social media, please. Whatever you do, I would avoid social media this time. Do not get your news from social media, please. Don't share a Twitter request from someone who knows someone who's a doctor at the government. Don't do that. Don't get to this. This is also Google. They set up a new site strictly related to COVID, and I've got all these links on a page that I'll be sharing as well. But please, Center of Disease Control, Florida Health, COVID-19.gov, and then Google also has a new website that they put up. Do not get your information, your resources from social media or from cable news. Please be informed, educate yourself so you can educate your patients. That's the healthcare aspect of it. And just announced today, Florida governor created an executive order to stop all elective surgeries. That way it'll free up more space in our hospital system for these corona patients. Don't travel anywhere. Don't travel anywhere. So that's kind of the healthcare aspect of it. There's a lot that goes into this, but just want to do a general overview, and then we'll share all these links. Now, I kind of want to go into the economic side of things. I can't stress, continue your home care visits. Unless, of course, you're presenting with any signs or symptoms, you have an increased temperature, or if your patients are present with signs and symptoms, in which we've outlined numerous times in memos what you do, and we'll also be sending it out again in the follow-up email to this this conference call here. So continue your home care. Take all necessary standard precautions as mentioned before. CMS on Tuesday of this week has announced that they will allow TheraHealth as a billable Medicare service for physical, occupational, and speech therapy. There's 3 codes, the CPT codes they're putting out: G2061, G2062, G2063. It can only be done by a PT, OT, or speech therapist, not assistants. The reimbursement is going to be minimal. We're still getting more information about that. Clinician, our EMR, is working nonstop at implementing this into our platform. So we should have this built into our system by Monday, I'd say Wednesday, the latest next week. And then we can roll out a plan as far as using telehealth as a billable service. Once the reimbursement is not going to be nearly as much, but it could be another source of revenue for those of us who see our visits decreasing, not only from PDGM, but now the coronavirus on top of that. So I'm looking for ways that we can combat the storm of decreased revenue, the economic impact that it will have on individual therapists and their families. A lot of you have spouses who may have lost their job recently due to this. So looking for any ways that we can help out economically. As far as you on a personal level, your family level, obviously monitoring your expenses. I as a business owner, have contacted all my monthly recurring expenses. You can negotiate, especially the larger companies' cell phone bill. FPL is allowing temporary freezes or delays on payments. You use this time with the very low interest rates. Contact your mortgage company, see if they have any options where that you can temporarily freeze your mortgage payment, or refinance your loan, get a lower interest rate. In the state of New York, they have postponed or freezed all mortgage and rent payments for 90 days. I expect if this disease worsens here in the state of Florida, they will follow suit. You can always put pressure on your local government here about that. But we will be getting some type of economic relief from the government, but don't wait for them. Be proactive. There's a 60-day freeze on student loans. The tax deadline got extended from April 15th to July 15th with no penalties. But if you're expecting a tax return, a refund, I encourage you to do that right away. And please don't use H&R Block. They rip you off and they don't let you write off anything. If you need some help on who to contact, get your own CPA, get a personal CPA, or if you're not if it's not a extremely complicated filing, use TurboTax, H&R Block Online. Please do not go to an H&R Block; they rip you off. And then also contact your credit cards. If you haven't contacted your credit cards in a while, contact them all. See if you can get a lower interest rate, and that will help you for the lifeline of having that credit card. But they also may have programs too in place where they're allowing a freeze on payments that won't hurt, that you won't get penalties or increased interest on. So contact all of your own personal bills. See what there's leniency on. A lot of these larger companies will allow or have things built in for people affected by the COVID-19. That being said, if things get extremely bad and you or a spouse needs to file for unemployment, unfortunately in the state of Florida, it's the only thing you can get up to is $275 a week. That's what it is right now. But there is a plan in the works, I believe it's in the House right now, for a $2 trillion stimulus package. And a lot of that money is going to be focused on increasing unemployment benefits, especially for people who are affected by the coronavirus, where you get all or a majority of your regular income. But I encourage you, this is where unemployment, that's the worst case scenario. That's if we can't weather the storm and get through this thing. But then again, don't wait for your government. Don't wait. Don't wait for them. Be proactive. There will be some type of economic relief. There will be, as this affects 99% of the country. Everyone is affected through this equally. That being said, ways that you can generate more income right now. I mean, obviously limiting your expenses, minimalist lifestyle. For those patients who are still allowing you to go out, when in home care, we're not seeing a tremendous amount of cancellations. I'd say about 10% of cancel. We had I believe 20, 22, 23, or 24 new evals last week. So we are getting new patients. But for those of you who are seeing an impact, utilize the billing system on Part B. Use those 5 units. You get paid per unit with this company. So if you're out there for longer, you get paid more. That could be a way that you could put more money in your pocket right now. And that is not abusing the system whatsoever. A lot of our patients now more than ever are going to need 5 units because they're stressed, they're concerned, they don't know what's going on. We're taking extra steps in sanitary safety precautions that take more time. Use 5 units. I encourage you, use those 5 units. You can get paid more per visit. That being said as well, here I can maybe hear the concern of that eating into the cap for the year. The cap for the year is $3,000 for PT and speech, $3,000 for OT. I also believe, as a Medicare rehab agency owner, that Medicare, CMS is going to be more lenient with that cap. Once again, we do not want to abuse that, but I do see more leniency on that cap, especially for those people who are directly affected by corona, either by self-choice, by self-quarantine, just due to high risk, or those who are mandatory quarantined. So I believe they're going to be more lenient with that cap because they see how important movement, monitoring of these vital signs with movement, exercise, activity, how important that is in disease prevention, infection control. So we are an extension of these patients' primary care physicians. We need to act that way. We need to do our best to get out to these patients. And if they're on the fence, let them know that it is extremely important for them, especially if they have multiple comorbidities, high hospitalization risk, to continue their therapy, because the one place you do not want to be right now is the hospital. That's for sure. So we just wanted to share that and once again, we are an essential service deemed by Homeland Security right here. And also on the economic relief as well. We have, let's see here, I got a lot of things opened up. Okay. There is right here as well, the Florida disaster loan. If you're a small business, there's certain things that qualify. I know a lot of you have your own LLCs. You need to have at least 2 employees. If you have a member of your LLC that can act as an employee, you can qualify for a loan, interest-free loan for a year. But then again, it's money that you'll have to pay back. If you're interested in this, you could contact myself or our office. I can share a little bit more information. And then also I have up here the Corona Tax Relief, just irs.gov/coronavirus. And it states in here the payment deadline extended to July 15th. And also, too, I encourage you, write off, keep track of every single item that you've purchased, whether it's work-related or personal-related right now, because the government is going to be more lenient in this time period, realizing the huge financial hit that everyone across the country is taken. And they will be more lenient. You will have more leniency on write-offs when filing taxes this year. Use that to your advantage. So once again, I'm kind of going through a general overview. I'm going through quick. There's 1,000,001 questions that everyone has. We will be available, but also when saying that, we're going to be sharing this link via email and text message, because some of you don't check your email. But be mindful. It's Ashley, myself, and Liz will be sending out these text messages. Be mindful. Liz herself has 2 kids now that she has to school and to teach while performing her job duties at TheraHealth. Ashley is getting 1,000,000 calls every night, every day, every Sunday, Saturday, doesn't matter. Be respectful, be mindful of their own personal time. Try to contact them during business hours unless it's an absolute emergency. If it's not an emergency, shoot them an email. That way they can check it out when they are doing business. Just some things I want to go over as far as economic. Health, we already know. We know that's where we're practitioners. But I did want to share that the Department of Homeland Security deemed therapy services as essential services. As far as the supply list, we'll be reaching out. We'll let you guys know what we have as far as supplies, what we're able to give out beginning of next week. Third thing, personal. Take care of yourself and your family. This is extremely stressful, and stress can lower your immune system. encourage everyone, exercise, go outside and exercise. And I'd say your backyard. I would avoid any public parks even. Um, go get exercise every day. Hydrate, vitamins B, C, and D. Take care of your own self. Hygiene, hand washing. Yeah, if you wash your hands 100 times a day, that's not enough. Wash your hands every single time you touch something. Don't touch your face. Um, and social distancing, obviously. Uh, Now a lot of you are burdened not only with the financial stress of this, who may have a spouse that has lost hours or has even lost their own job, but now you got to school kids, sometimes multiple kids. How the heck do you do that? So the final thing I wanted to share with you, I would consider myself extremely knowledgeable on the economic side of this stuff. As far as the child care, I have zero knowledge whatsoever, but fortunately, my mom has been a second grade teacher her whole life. She then was an elementary assistant principal. She volunteers at multiple youth organizations, and she has a specialist degree in elementary education. And she shared with me a lot of helpful websites that you can go on to help your kids with their learning because they're out of school for this entire year. Um, and I have those all here, which we'll be sharing as well. Um, okay. Excuse me. By the way, I just coughed and I just coughed into my elbow, and then I have hand sanitizer right here that I am using. I'm the only person here, by the way. Practice, makes you practice that. Every day do that. Every day, coughing into your elbow, coughing into your shoulder. Okay, so helpful links and resources is showing up on your screen. First one was the website APTA that deemed us essential as far as services go during this epidemic. And then the state of Florida resource guide, financial assistance loan program for small businesses, Center for Disease Control and Prevention, and then Google's custom site, what they just created. Don't get your news or updates from cable news, social media, or your friends. You will not believe the outlandish stuff that I've heard from random people that it's just going to stress you out. It's not real. Don't get your Center of Disease Control, Florida government, the Google sites, or your local news. Don't get social media and cable news. That they're terrible. So don't listen to them. And there underneath that, links for information, games, schooling, just anything for your children who are at home, and now you're stuck with this dilemma. How now you're a mom, you're a father, you're a caretaker, you're a therapist, and now you're a teacher on top of that. So it's tough. It's tough. So we have Generation Genius and abcmouse.com. They're both allowing you to have a free month of that. Generation Genius is more for science activities. ABC Mouse, a lot of reading. Then you have Blockly Games, which is actually a Google product. And it's like a coding site. And there's more advanced stuff and games, and it's maybe more for older students. You Google search Kahn Academy. They've got a lot of programs, a lot of things on YouTube as well. Then ed.ted.com, mysteryscience.com, fccr.org, reading, and then also it allows you to type in your child's deficits, their grade level, their reading level, their deficits, and it will actually have customized games that will help them with whatever their deficiencies are. Real cool site. Coolmath.com And then more of a fun, artsy type of thing, YouTube search lunch doodles with Mo Willems. So these are some things for those of you who are now burdened with the task of becoming a teacher. Once again, we have the questionnaire, all new patients, and then once you see your patients, the links, our shelter-in-place letter that you'll carry on hand at all times now. Although Florida is not a shelter-in-place state as of March 21st at 6:40 now. And then I sent this email memo out at the beginning of this week, if not over the weekend, last weekend. The questionnaire, temperature readings, I want to add O2 stats, mandatory for every single treatment. If anyone has signs or symptoms of the COVID, corona, that was labeled on this questionnaire form, or if they answer yes to any questions, we will not treat them. We'll put them on hold for at least 2 weeks. We will contact their MD, primary care physician. If you need help contacting them, let us know. And then we advise the patient to self-quarantine for at least 2 weeks, obviously get tested. If symptoms are moderate or severe, have them immediately contact MD, or you immediately contact the MD. Have them seek MD advice as far as ER, urgent care, or home visit by the MD. We don't want them going. Call first. Call first. Only in the most severe temperatures, extremely high temperature, aggressive cough, and aggressive shortness of breath, call 911. You must be cognizant of the pressure on the general healthcare system and do our part to prevent risk of disease by applying our clinical expertise. Right now, we are an extension. Let me put this once again in perspective. I saw a patient this morning, dialysis patient, extremely immunocompromised, oxygen. I went there. They're eliminating the home health aides that come in there, so he didn't have a home health aide this morning. I spent very little time of actual physical therapy on that patient, and I ended up cleaning up the ZPAP or CPAC machine, his breathing utensils, helping him with toileting, helping him with hygiene, and really just self-care stuff. We got to change our thinking right now. We may not be necessarily doing intense manual therapy or advanced neuro rehab right now. We may be there as a mental therapist, a physical therapist, a self-care, an ADL, a homemaker companion. We got to broaden our horizon right now while also being extremely conscientious of sanitary barriers, of disease control, infection control. This is all stuff that we know. We can get a little lackadaisical with these procedures as time goes on, and I can't stress the importance of this. And we are helping out. We are aggressively searching for more masks, more gloves, more hand sanitizer. At our clinic, we have a screening room in the waiting room where the patients answer the questionnaire, they get their temperatures reading, and if any of that is positive, they're sent home immediately, physicians contacted, and then if all of that's negative, they present with no signs or symptoms, no temperature, then they can enter our sanitary treatment area, where all the therapists are wearing masks and gloves at all times. So be smart. And so I just want to let you know that we're here for everyone. I'm sorry if this was jumbled and rushed and kind of all over the place, but we've had very limited time right here. We're trying to combat this as a business, as healthcare professionals, as fathers, as mothers, as brothers, sisters, children. We're trying to combat this on our own personal lives as well as helping out all of our therapists and all of our patients. We will be getting more information out about telehealth by Wednesday of this week. So Wednesday is the 25th. That just a few days away. Clinician is working diligently at implementing this into the EMR. Clinician also holds town halls every Monday through Friday, and I'm getting a lot of useful information. Clinician's a big company. I'm getting they're having big conference calls with therapists, physical occupational therapists, speech therapists, practice owners from across the country. There's people from New York. I was the only representative from Florida. A lot of their clients are on the West Coast, but they're all sharing information and helpful tips and what we can do in this time period. That we're here as a resource, but also be mindful we are a small business. We've got myself, and there's 3 people here in the office, and then there's 1 at the front desk of the clinic. So be mindful of the office staff's time. Respect their time, please. We are here to help, but we're only 4 of us. So anything that you want that's not immediate, email us. That's not a life or death situation. If anything's life or death situation, you should be contacting us. You should be contacting 911 or the doctor. But we are here to help. We will be sending out an email and a text message with this entire I'm on GoToMeeting with this audio and a computer screen that I'm sharing. And everyone be safe. Take care of yourselves. Practice proper sanitary precautions, disease control measures that are now mandatory, not only by TheraHealth and Wellness, but by ACA. If you are sick, if you're feeling anything unusual, if you have an increased temperature, that's one more thing. Take your own temperature every morning, every night, practice proper hygiene. Okay, thank you all. There will be more to come. If anyone has any ideas, reach out to us, let us know. We may be getting a type of like a blog or channel or something where everyone can communicate and share information or ask questions or just share concerns. And as we get more information, we'll be releasing it. Thank you all. And be safe out there. We appreciate everything you do. We'll get through this, and we're here to help. All right. Have a great evening.